morning, everyone. Welcome to our weekly COVID-19 media update. I am Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start like we always do with our numbers. We have had so far in Shasta County 397 cases since the beginning of this incident. We had 7 confirmed cases on Monday, as well as 38 negative tests. We believe that that number is underreported due to some data challenges at the state level. The state databases, they're trying to figure out some problems with that. We announced that yesterday in our incident update. If you wanted to go and learn more about that, it's posted on our website. We've done 22,680 negative tests for a total of 23,077 total tests. We have 46 people in isolation. Those are people who have tested positive. We have another 306 in quarantine. Those are people who have been identified as close contacts. It's a very large number for our contact tracers to be keeping track of them, symptom monitoring and all of those things. We've got 8 people who are hospitalized, and of those, 3 are in the intensive care unit, and we have had 9 deaths up to this point. I would love to introduce the other folks who are here with us today. We have Matt Pontus, the CEO of Shasta County. Karen Ramstrom is our health officer. Mark Mitchelson is from Shasta Regional Medical Center, and Dean Germano is from Shasta Community Health Center. I don't see faces for these folks, but there are other people who are here with us today, including Amy Forrest from the United Way, and Dr. Michael Vovakes. He's our Deputy Health Officer during this incident. Do any of our panelists have anything that they would like to start out with before we go to media questions?
I do. Good morning, everybody. So I just wanted to make a couple of remarks this morning. We've heard some comments that have caused me to believe that there's some misconception out there about COVID in terms of the impact, in terms of how it affects you, your body. And so there seems to be a misunderstanding that it seems to be kind of like an influenza. And I just wanted to talk a little bit about that this morning. So COVID-19 does actually affect the lungs, but it's actually more of a systemic illness that causes inflammation and can involve multiple organs. And we're still learning a lot about that, but I wanted to just address that lack of understanding, because we hear about people who say, oh, just go out and get it and it will help our community to have immunity. And we highly discourage that. Even among younger people, they can actually have pretty severe illness. It can involve not only the lungs, but it can cause blood clotting that can affect the lungs, as well as other organs, including the brain and extremities. It can affect the liver, kidneys. It can definitely affect the neurologic system, causing problems with cognition and cause encephalitis. It can cause some residual fog in people as they're recovering. And as you know, in children, it can cause multi-system inflammatory syndrome, which seems to be pretty rare, but it can happen. And it can involve the heart. There was a recent study that actually showed that even among people who, 100 people, about a third of them were in the hospital, 2/3 recovered at home. Across that group, about almost 80% of people had cardiac involvement and 60% had residual inflammation 2 to 3 months after the infection. So I just want people to really take care and be, and observe the prevention measures. We will get there with immunity when we have a vaccine, and not before then. And so in the interim, we just want to make sure that everybody's staying safe and really primarily practicing physical distancing and just hanging out with your normal core group of individuals from your household primarily. I think that's all I have this morning. Thanks, Carrie.
All right, anybody else have anything to share with us this morning before we go to the media? Seeing none, we are ready for media questions.
Well, I have one for Dr. Ramstrom, or maybe more than one, about higher education. What kind of guidelines have we received? Like Simpson University is supposed to be open to more or less normal classes soon. Where are we with higher education?
Right. So we had a call with the state last week, and we anticipated that written guidance would come out last week, and it has not. We have a call with the state again tonight, so we're hoping to get more information. They actually walked through the draft guidance. It's about 35 pages. It's quite involved. And it sounds like in jurisdictions that do not have, that make the determination that their level of disease transmission makes it appropriate for higher education to open, that can happen. And at least that's what we're told. We haven't seen it in writing yet. But it will be quite involved in terms of what those institutions need to do in terms of prevention measures, not only in terms of occupancy and distancing in the classroom, but there's considerations for the dorms. They have to implement the guidance for their food facilities. Any congregate areas they'd actually have to address in terms of physical distancing. So it kind of goes on and on. It's quite extensive planning on their part. And so we will, we're all kind of anxiously anticipating that guidance coming out. We've been in contact with Simpson and have been communicating with them, and our incident command is planning to meet with them very soon to talk through their individual situation.
Good morning, Dr. Ramstrom. Ethan Hansen here, just from the sports perspective of things. Talking with some of the athletic directors last week, they told me that that league official should be coming forward with a health plan to hopefully have sports again this week. Can you confirm that? Have there been any plans that have been submitted to you? And can we expect maybe more information about whether or not high school sports can reopen again?
So, so guidance from the state came out on August 3rd, so earlier this week, and it's on our website. And youth sports, as we know it, are not actually allowed. And so, if you refer to that guidance, you'll see there's two main criteria that youth sports and physical education have to meet in order to be permitted. It has to involve physical distancing of at least 6 feet. And the emphasis is on a stable cohort, and that really applies really to physical education and outdoors as much as practical. In communities like ourselves where gyms are open, you can have indoor activities, but it has to, there's certain parameters around that. If there's heavy exertion, that's really recommended to be outdoors, and again with physical distancing. The focus is really on skill building and conditioning, and it still prohibits tournaments, events, or competitions, regardless of whether other teams come together from different schools. So, so that the types of activities are going to be limited to those that do not involve close contact, and competitions will not be allowed.
Okay, and then
so,
okay.
We don't anticipate getting any plans. Those are the state guidelines, and so I'm not sure what would be submitted to us, because they these guidelines came out, I think, after that CIF notice that indicated working with local public health. But these guidances come out since then, and so we would expect them to be using this guidance to develop, their plans, which is going to be pretty limited.
Okay, so but neither the Northern Athletic League or the Eastern Athletic League have submitted a formal plan to reopen sports. That's correct? So
they cannot reopen sports unless it's something like maybe tennis, or I don't know, perhaps volleyball. I don't know. You'd have to do that in a way where you're not coming in contact. So it's difficult. So the bottom line is there's not going to be a lot of athletic sports happening this year. And so there's really no reason for them to submit a plan to us. There is also guidance in the school guidance as far as what schools will be planning. And then this youth sports guidance supplements that.
Thank you, ma'am. That's all I have. Thank you.
Doctor, if I could go back to education for a minute, but now for the younger folks, there's such a debate among parents in schools to reopen the classroom or not. Could you give us your opinion? And also, if you had a child right now, would you let that child go into the classroom?
So, the planning for the school year has been really challenging, as you all know. The guidance has been evolving and was kind of updated and became more definitive from the State Health Department from a health and safety perspective for schools, and not until mid-July. And so the schools had been working very much over the summer, trying to figure out what they're going to do and planning to be able to accommodate distance learning, because at a minimum, they have to do that. I think the reassuring thing about children is that they're less likely to transmit this virus. And so in the school setting, we're more concerned about the older kids and about adult to adult transmission. And so the state guidance actually accounts for that and includes specific prevention measures, including masking, and distancing the teacher and other adults in the classroom from the children, and real focus on cohorting, especially in the younger kids where it will be harder to physically distance. And the idea is that because, potentially using smaller classrooms, whether that's because there's fewer kids, families that choose to have their children there, or because other spaces are used. But because the guidance has come out so late and there's so many different considerations, I think the schools are in a position where they're having to do this planning right now, and it's really challenging. So I think there's a lot to be determined. I know that everybody's waiting for some final information, and so we would just, encourage, parents are going to be hearing from their individual schools, because the plans are going to be dependent on the physical layout and how many children are planning to come back in person. We are allowed in Shasta County to come back in person. And I think especially for younger children, I'm not as concerned about transmission because they don't seem to, the evidence indicates that they aren't as likely to transmit to each other or to adults. I will say that we have been working though closely with the superintendents and have developed very specific guidance should a child or school staff be symptomatic at school, what to do if a confirmed case happens to be at school, and what to do if there's close contacts in the school setting. And so we have all of that in place and are ready, and have been talking also with the school nurses about that. So there's a lot of, I think in this last week, decisions that are going to be made by the administrators and at the school level.
So it sounds like if the guidelines are met, that parents can be pretty confident in sending their children back to school. That's what I'm hearing. And you'd be okay with little Karen Jr. going to class.
I would. I guess I would just say that I'm very comfortable with my nephews going back to school. How about that? So, I think parents see the value and they want their children to get back to school and to have all the benefits that offers. And I am comfortable with what the state has outlined, and it's a matter of making it happen. And there's been a lot of work around this. So the Office of Emergency Services have made available a personal protective equipment to the schools. So they have some resources for those kinds of things. We've been able to make available some plexiglass for when that's helpful. But it's just the trick is that we're just down to the last minute, and so we'll see how it all plays out. And I think still schools are making decisions even now. But yes, I would be comfortable with Karen Jr. in the classroom.
Thank you, Doctor.
Hi, good morning, everyone. This is Anna Torrea calling from speaking from Action News Now here. I know it was mentioned briefly earlier about the underreporting, but I just wanted to get more information. So with these glitches, what does this underreporting mean statewide as well as locally here in Shasta County?
Sure. So we actually have been talking about it here at our Department Operations Center, and our epidemiologist supervisor has actually done some initial look at kind of our, where does our data come from? And, we aren't too concerned as far as the data that we have locally. So for a few reasons. One, we know about hospital cases because we're in communications with the hospitals every day. So we're not worried about an undercount there. We have provider reports, and our providers are pretty good at reporting. The state testing site, we actually get those labs in a different way than through the route that's an issue right now with CalReady and the electronic lab reporting system. So with all of that in mind, we don't think that we're too far behind. We might be missing a few, but we have reports coming in enough other from other methods that we're pretty comfortable that we're not missing a large number. But we're continuing to analyze that. So more to come.
And just to follow up with that, you said that Shasta County gets its numbers in a different way, not through CalReady. What's the way that the county gets its case numbers?
So we do get them through CalReady and from the electronic lab reporting. That's the piece that's not working right now. As I just mentioned, all the ways I just mentioned. So the hospitals, we get hospital data every day because we talk to the hospitals. We get provider reports of lab results because when a provider orders a lab, that provider actually gets the results and provides that information to the patient and reports it to public health. They're required to report to public health. We get it from a line list that we get from the state testing site. So those are all the different ways that we're also getting lab reporting, not just electronically into the communicable disease registry that we use called CalReady.
Okay, thanks for making that clear. Also, to follow up on that, so like you said, Shasta County doesn't seem to be too far behind. Like we're still seeing the cases we need to, just some here missing are here and there. But for Shasta County, are we still seeing like an accurate picture? Cases here.
Right. So, we will see, we're getting another update this evening from the state about where the fix is. The other stopgap that's in place is the state has asked labs to go back to the old way they used to report to us, whether it's sitting as an Excel spreadsheet or faxing or what have you. And so that's going to be happening now. And so hopefully it will just be over these few days that we might have missed a handful. We're hopeful that it's not a large number, but we're going to keep evaluating it and make sure that that's the case.
And to also follow up on that, do we know what is the cause for this underreporting?
Yeah, it's an issue. It's a technology issue, something with the software where the ELR connects to the CalReady, which is the communicable disease reporting data system that's used statewide.
And can we see this problem, like, do we know a timeline when this problem will be fixed statewide?
We know what you saw in the press release yesterday. The state's working on it right now, very aggressively. And so, like I said, in the interim, the labs will be reporting to us in a different way.
I think that's kind of it on my end. Thank you, Dr. Ramstrom.
Hi, Steve Gibson, KQMS. Dr. Ramstrom, recently there was a general warning put out to businesses who were not following guidelines that the county may revoke some of the county issued permits that allow them to continue to do business. Has anything advanced on that? Is there any permits that are going to be revoked, and how would that be done in an even-handed way? I could see restaurants being very resentful of other restaurants who don't get their licenses revoked or permits revoked, and you see what I mean. It could turn into a morass of resentment among the restaurants. How exactly would that take place?
Right. So, I think, as you know, and was in the press release, we really encourage and prefer voluntary compliance and are really continuing to promote that as well, and working with some community members in the restaurant industry to try and get that message out there. There are other entities that have been enforcing their own laws, including the Alcohol and Beverage Control California. They've been in the community and have visited and communicated with a dozen or a few more restaurants and bars because they have jurisdictions over those entities too. In terms of where we might go in terms of permits. So there's currently conversations about what that might look like, and being very cognizant of, you, as you just alluded to, making sure that we do that in a fair manner, and coming from that place where, you know, we prefer to have businesses, including restaurants, come into compliance in a voluntary manner. But if they don't, then we are working on procedures that we'll have in place and processes where we can address that, whether it's with permits or in court or what have you, because it does put our community at risk. And it also is not fair to those businesses that are working really hard to do the right thing. And so that's one of our main concerns as well.
Any other media questions?
I have one. Good morning.
Okay.
There was a recent news story about a ear, nose, and throat physician who was recommending a treatment where the substance is mixed. It's supposed to be very simple, and it's inserted in your nostrils a few times a day. I was just wondering, Dr. Ramstrom, what your thoughts were about that treatment.
Sure, I'm going to actually ask our Deputy Health Officer, Dr. Vovakes, if he's interested in sharing the love here and what he knows about that.
So what Dr. Dome, he's an ENT doctor, was referring to is a providone iodine solution, which the ear, nose, and throat doctors use before they do nasal surgery or sinus surgery, just to kind of, wouldn't really sterilize, but will kill the germs and viruses and bacteria up in your nasal passages so they don't get an infection after the operation. And that sort of solution does work as far as used in that way. And there are ongoing trials now, one at University of Kentucky, trying to see how this would work against COVID. I guess and it's been used before for the original SARS and for the MERS, the Middle Eastern Respiratory Syndrome. It's not really, as far as I'm understanding it, a curative or a treatment. Would be used like for healthcare workers that have to work in close contact with patients and maybe reuse their PPE a lot, that this would maybe prevent them from getting this virus in their nose. But you understand, you wouldn't protect your eyes. So we worry about eye contact from droplets. And it seems like you would have to spray this in your nose several times a day. You would also have to gargle and wipe and wash your mouth with this solution several times a day, because this virus could get into your mouth also, and we wouldn't have any protection for the eyes. So I'm unclear. I think he's going to talk with Dr. Ramstrom and I later this week, but I'm unclear as to how this would be something that would be used by the public, and it just seems it would be rather awkward. I guess it's safe except for people who would have a thyroid condition. There is iodine in this product, and so the thyroid gland likes iodine. So if you had thyroid cancer or thyroid condition, you would be kind of prohibited from using something like this. But it's not clear to me as a physician how this would be used, except for those particular incidences with healthcare workers in this whole pandemic situation.
I would just add, at Shasta Community Health Center, amongst our clinical staff, we take the position that any kind of interventions need to be evidence-based, and this hasn't been tested in that evidence-based to the extent it needs to be. So, we're not promoting it.
That's helpful. I have a follow-up question. If someone were to gargle with this substance and swallow it inadvertently, would that be harmful?
I don't know. I've not actually looked at it that way. It's a dilute iodine solution, so a small amount probably wouldn't be harmful. The other thing about this, there is a commercial product available produced by 3M specifically just for preoperative nasal use in nose before nasal surgery procedures. But again, there's not any FDA or other approval for use of this for the COVID-19 or for the other SARS or the MERS. It's just, something that people have looked at. And like I say, there are ongoing clinical trials right now. So I just don't think we have all the safety information about it yet.
All right, any other media questions? I have a few public questions. I think this is a great one for Dr. Ramstrom. The question is, if masks are mandated and helpful, how is this getting worse? I think we would definitely start by saying that we only had 7 cases, and we have a very high population, and our rates are much lower than some places. So would it be fair to say that the masks probably are working to some degree here?
Yeah, for sure. I think that they're having an impact, and all of the prevention measures are additive. And so, the more that we're doing in terms of using these prevention measures within our businesses and other sectors, and taking these personal prevention measures, using those as, daily behaviors, all of that actually makes a difference. And, if you look at the other counties, I think even though we don't have, 100% of compliance with mask use, and some of that may be personal choice, and some of that may be because people can't wear them because they have medical conditions or other issues. It doesn't have to be 100% to make a difference in disease transmission. And so I think the numbers are going up because this virus is pretty it's contagious, that we have no immunity. And so none of these measures are 100%, and that's why we recommend doing all of them in order to have maximum benefit.
And as we always like to say in the Health and Human Services Agency, it's very hard to measure prevention. It's hard to know what would be happening in our community right now if everybody did not wear masks ever, but we can probably assume the number would be much, much higher. The other question is for our hospital partners. Will nursing students be doing clinical time at the local hospitals, and will they be caring for patients with COVID?
Hey, Carrie, can you hear me? Carrie, am I on? My screen's frozen. I don't know if I'm.
Oh, sorry. Yes, we can hear you, Mark.
Okay, perfect. So for our facility, yes, we are having nursing students in the fall. We're very excited about that. They're a great help for us in the hospital. But for the case of will they be treating COVID patients? And that's a hard no. Really, these patients obviously are highly contagious, and you want to minimize the amount of people that are interacting with them. So we are really trying to skinny down the treatment team to only essential people taking care of them, and nursing students wouldn't be one of them. So we want to prevent the risk of transmission, and so we will it's a great disease process for these students to learn, but the risk of transmission is too great that we're just trying to minimize the amount of people taking care of them.
Awesome.
This is Kenneth from Mercy Medical Center. I echo the same thing that Mark said. We're excited to have the students back, but no, they will not be taking care of COVID patients.
All right, thank you very much. I don't have anything else on my side. Any last minute media questions before we go our separate ways? All right, thank you everyone so much for participating. We'll be back again next Wednesday at 11 a.m. right here. Thanks for participating. Everybody stay safe and healthy.